Hi, I'm Amanda Ralph, a nurse practitioner and the owner of White Coat Aesthetics here in Las Vegas, Nevada. Today, I wanted to go over filler dosaging. So, I believe we've talked about Botox, maybe not specific dosages per unit, but I know we've talked about the general areas that we can do Botox. Let's talk about filler. And I will say a lot of this is kind of opinion based, but this is all based on my opinion as an injector of 8 years. So I do have a lot of experience in this field. There are going to be slight variations, but I just want to explain to you what my recommendations would be. And I want to talk about this because I think one thing that new injectors really struggle with is having consultations in the room and then predicting how much of a product they're going to use to give the outcome. Yes, you will get more comfortable with what you require in order to do this, but this is what I have found in my own practice. And I do a lot of full facial balancing, so I feel confident in sharing this information. Okay, first off, I just want to explain to the injectors and the non-injectors how filler works. Filler comes in one syringe. It comes in 1 ml, okay? 1 milliliter of the filler or the hyaluronic acid gel, okay? Botox is different. Botox comes by the unit. Filler comes in a 1 milliliter syringe. Versa comes in 1.2, but most of the time it comes in 1 milliliter. With that, you do not want to open a product and share it amongst multiple clients, because what that does is as soon as you open, the product itself is sterile. As soon as you open it, you are breaking sterility, right? You are going to be introducing some sort of pathogen at the site around the area. And with that, I really do not recommend using a partial amount and saving it and using it on anyone else. I highly doubt that that's legal. Do not think it's within the guidelines. I never do that. So 1 ml needs to be used on one client. When we are new and when you're early being trained, typically what we kind of teach you is that one syringe should be used for an area. So like a cheek or a lip or a chin or whatever. Okay. So I will say the longer I've been injecting, I am now breaking up that syringe into multiple areas of the face. But I think it's because I'm so comfortable injecting every single area. And when you're new, it's very it's totally fine to say, just going to start with your cheeks and then we can do more. Okay. So some of this dosaging, although it won't talk about the full syringe, I just want you to understand what we're discussing here. And there are lines on the syringe, and the numbers start at 0.1, 0.2, 0.3, all the way up to 1 whole syringe, okay? Let's start with temples. So when it comes to temples, I usually will plan 0.5, half of a syringe, to 1 syringe. I always kind of have a range. Yes, you can do more than that, and there are people who are extremely volume deficit that probably will need more. I would consider myself a little bit more of a conservative injector, and I would rather add more later than shove too much in at once to allow for healing, to allow for, risk reduction. So typically, when I am doing temples, I am planning half to a full syringe in each temple. Okay, so 2 syringes is usually my starting point. When it comes to cheeks, at this point, when I was new, I used to start with 0.5. At this point, you're getting a full syringe in your cheek. It's rare that I find someone that only needs a half in each cheek. So cheeks, I usually plan 1 syringe. If a lot of times now what I will do is a little here, right in this area, which is almost a tear trough, but really more of a mid face. And then right here at the piriform aperture. I won't use a full syringe in this anymore. What I will do is I will take some of my cheek filler product and I will usually do 0.1, 0.2 here, 0.1, 0.2 here, and then I have the rest for the cheek. So for me, this mid-face area is 2 to 3 syringes. Very rarely less than 2. 2 to 3 is a good range for me in this mid-face area. That gives me enough to kind of play around with it. If I need to do a little bit more here, I can. If I need to do a little bit more here, I can. But then I can still build a full cheek out of that. Now let's move on to lower face. When I first started as an injector, I would do 1 syringe in the chin. That was what I would recommend to people. But my issue with that is I can make such a better chin with 2. The reason being is that we focus so much on projection from the front of the chin, but another very important part is this here, this pre-gel sulcus. And I find that if you add a full syringe here to someone who's even a little weak here, it will make this weaker. So I either need to do 0.5 here and then try and break it up here, or a full 2 syringes. In reality, I would love 2 syringes for the chin. One primarily for the front of it, and then half on each side of this pre-jowl area. When I'm doing a full jawline on a woman, I'm typically quoting 3 to 4 syringes. On a man, I'm quoting 5 to 6. Men want a stronger jaw. Also with women, we typically ignore this middle section because we don't want to add to the jowling, whereas men often don't get that. And so I go directly into this area with filler, and of course I'm going to need more filler for that. One thing I would recommend is that when you are new, it's very tempting to kind of undertreat and underdose. But the problem with that is that you still poked someone probably about the same amount of times, or at least you still poke them. If someone feels the trauma of getting injected, they want to see a good result. And so if you are undertreating and you're doing too much for them to actually be happy, they're going to be more upset than if you are like, wait until you can afford the right amount, because then I can give you the result you're looking for. And this, of course, comes with time, and you will become more confident with time, but do not underdose and do not recommend in your treatment. So for me, it's a hard 3 to 4 syringes on the chin, on the jawline. And with women, what I'm usually planning on that is 1 on the back of each jaw, half to 1 on the back of each jaw, and then the rest in the front here of the chin, because the chin is such an important part. So yes, then when it comes to lips, I will say there's a lip filler product that does come in a half syringe that I have used in the past. So sometimes a half is a good option. But for the most part, I'm planning on using a full syringe. If I have a little left over, I might put it somewhere else. But it's rare that I find that someone needs a half when we could be doing a full. The full is going to give them longer results. It's going to give them the lip that they're actually wanting. I tend to reserve my half syringe product for my very old clients with very thin skin who just need a little lip plumping, rather than anyone under the age of like 50, because I can find a way to use that product without you looking crazy. So that is one thing I recommend with that. I would never do more than 1 syringe at once with a lip filler. Never, ever, ever. I would not even attempt it. I do not do that. I do not want your lips to look crazy, and I want to maintain the integrity of your shape. So for me, 1 is my max. If you want to come back in 6 months for more, we can look at that, but 1 is usually my max at 1 setting. Then when it comes to marionette lines or smile lines, it's really hard to say without seeing it. Obviously with smile lines, I am focused on the cause. So looking at improving the area up here and right at the corner of the nose. And I usually don't do a lot of product behind here because I don't want to completely knock it out and make you look unnatural. So usually I'm planning 1 syringe split across each side here, and the same here. Although sometimes I will use what I've been using for the jaw to just come up this way and kind of soften that area. That is my filler recommended dosaging for you. I hope that helps when you are new and getting started in your own consultation practice. Obviously, this is my opinion, and everyone's going to have their various level of opinion here, but I just generally have these in my mind so that when I'm discussing this with patients, they understand what I'm offering. One thing I like to say is I always quote a range. So if someone's wanting cheek and mid-face, I usually say I would recommend 2 to 3 syringes or 3 to 4. That way I get their approval on the budget before we start, and I tell them how much. I say if I can get it done in less, I will, and I often do, but I have that wiggle room in case I'm going to need a little bit more than I expect. And then what's great is that if they were expecting to pay the larger amount, and then I'm like, I actually only need to use 3, great. They just feel like they save money because they were expecting to have to pay the higher amount. So I would definitely recommend a range. I would definitely explain, all the parameters here on what you are doing when you're dosing filler. But yes, let me know if you have any questions, if there's anything I can answer for you.